UHW collected enough signatures for both initiatives and used those signatures as a way to try to force negotiations with CHA. What resulted from that was a non-initiative solution, which included an agreement that that gave us opportunities with UHW, including legislative, regulatory, possible ballot initiative opportunities, and other such options if the agreement worked out well. The main part of the agreement was to obtain 100% of the maximum allowable federal funding for Medi-Cal that is available under federal law without resorting to a hospital fee or tax. The potential benefit of that is about $4.4 billion annually. Ann McLeod will talk more about that in her section of it. The agreement had two different documents involved with it. One of them was a memorandum of understanding, which dealt primarily with public communications between hospitals and unions, talking about public conversations being positive, factual, non-confrontational. There was also a code of conduct which covered both public and employee/labor relations. The code of conduct not only covered the three items that we just talked about in terms of public communications being positive, factual, and less confrontational, but also was intended to have mutual health reform goals for employees of the hospital that would presumably be unionized, and then also rules for communication with employees during organizing efforts related to the code of conduct. A big central part of this agreement was a $100 million joint advocacy fund, and the whole point of the joint advocacy fund was to obtain the mutual goals of getting Medi-Cal reimbursement to the highest allowable under federal law without resorting to a hospital fee. The money would be overseen by both CHA and UHW. Distributions would be overseen by both, and Gail Blanchard-Sager will talk more about this in just a moment. And then the money would be rebated proportionally if an off-ramp were taken. Off-ramp of the agreement. Part of the agreement was contingent access by UHW to hospital employees, but in the year 2017. And that contingent access would only be available if full Medi-Cal funding that I've described was reached by the end of 2016. The agreement was that hospitals would identify units of people, 30,000 employees, to which contingent access would be available if the Medi-Cal funding goal was reached. The MOU and the Code of Conduct don't prevent hospitals from sharing their own point of view. It was not a neutrality agreement. It is not. And the NLRA rules apply, secret ballots apply. This is definitely not card check. The agreement is not without challenges. Political balance. There are challenges within hospitals, within the public, within legislators, within the entire political environment, with the administration, and with other stakeholders within the entire hospital and labor community. Union dynamics have their own set of challenges, both with other unions and even within the SEIU International itself. Certainly we've faced challenges within our own CHA membership. There are differing and valid points of view regarding unionization. There are some challenges just in achieving the results of full Medi-Cal funding. Certainly by 2016, that is very challenging. There are challenges past 2016. The future there is murky, and Dwayne will address that when he comes back on towards the end of the program. And there are even challenges keeping on track with this agreement, as there is constant communication between UHW and CHA. Gail Blanchard-Sager is going to talk a little bit more about the Joint Labor Management Committee now.